there's a kind of notion that black females are strong. So we find that sometimes we're missed out on pain relief, and sometimes we don't even get information that we need for our own records, and we just get told to get on with things and stuff like that. And it's just that kind of unconscious bias, really.
Now, I would really like to know why it is that there's this disparity in treatment, except it makes our people, the BAME people, scared to seek healthcare. And so many of us are just stuck at home with symptoms, with pain, because we're afraid to go to our GP, because we're not being listened to. You know, we're told, you should be really glad that you're here and you're getting this treatment free. Where you've come from, you'd have to pay for it. Can you believe that? That is so condescending. It's so condescending, and it makes us feel as though we're nothing. It just takes away from us.
We're also quite a small part of the population. I think it's something like 3%. And so in terms of, for example, research, sickle cell disease it affects lots of communities, but it does affect our community. And so I know, for example, treatments in America is way ahead of anything that happens here. And so we don't get a look in. We're not particularly vocal. We don't particularly complain. We'll talk amongst ourselves about the issues, but we wouldn't necessarily take it further. And just a sense that we're not even just respected, but that we're not really we don't particularly matter.
As a person of colour or woman of colour, unfortunately, we do come across a bit of a shortage with regards to how we are dealt with in the health and care system. Yeah, and it's something that shouldn't happen. And it's almost like there should be a basis, a basic foundational education on how to assess or how to deal with illnesses that are prevalent in particular ethnic groups. I feel like that's very important.
The system is kind of, it's a big it feels like a big juggernaut, and it won't actually move or meet the actual access needs of people with learning difficulties or learning disabilities.
People might know, obviously there have been people in the past that have Down syndrome that get DNRs put on them in hospital simply because they have Down syndrome, and the reason you wouldn't resuscitate them is because they have Down syndrome. So I think what COVID has shown is that we don't have consideration for people that can't speak out loudly.
You can't dump people with physical disabilities who are young, wanting to live on their own with elderly people in a team. Feels that people with disabilities are generally at the bottom of the pile.
I work for the Centre of Sign, Sight, Sound, and we work predominantly with people whose first language is British Sign Language. We have situations whereby we have people going into hospital and undergoing medical treatment and not knowing what it is that they're actually having done because they've been unable to give proper consent.
I first started off as a general student nurse and was absolutely horrified and disgusted at how people with learning disabilities were treated when they were in hospital. Yeah. So decided to transfer over to this line of work. And I'm not hand on heart 100% sure that we've improved that much over the 30 years. And I think people are still seen as second-class citizens.
Looking after the elderly. So if, for example, you ring for a GP or for an ambulance to come for somebody who's poorly, you can be waiting for an ambulance in a care home probably for about 8 hours before somebody can come and see an elderly patient. So for me, healthcare for the elderly is not that great. So that's how healthcare looks for me, that they're like the forgotten generation, and yet they're just as equally important as you and I are.
Well, like I was on the gender clinic waiting list for like 2 years before I got proper contacted by them to say like, okay, yeah, you're 18 now, you're moving on to the adult wait list. And I'm like, okay.
It is really, really important for us, undocumented, documented to register They don't go to the GP for checkups. 2 weeks ago, a Filipina came to us, and because she said she's not, there's something that she's feeling on her body, but because she has no GP, she just stayed at home. And then one day, she couldn't bear it anymore. So she was forced to go to the GP. She was referred to the hospital, and then she was diagnosed of stage 4 cancer. So why do we need to wait until, we are, ang tawag doon, yung malala na, yung naramdaman natin, that we couldn't take it anymore.